Here's everything you need to know about sepsis malpractice. What is sepsis? Sepsis is an infection in your bloodstream. Here's how it starts. Let's say you have a surgery, you have some kind of open wound, and some bacteria gets in there, and you can develop an infection. And most infections are really localized, which means you'll see some redness or tenderness at the site of the wound. Most of those go away by themselves, or they require some minimal antibiotic treatment if the infection is not going away on its own. However, if an infection gets worse and is allowed to progress without being properly treated, it can get into your bloodstream and cause a condition called sepsis. Sepsis is life-threatening because if that infection gets in your bloodstream, it can travel all through your body and infect all of the organs in your body. And after time, your body will be overpowered by this infection. I get too many people who call about a loved one who's died from sepsis, and the first question they asked me was this death preventable? Could sepsis have been reversed? I can't tell you that's the truth in every case, but in many of the cases that I've handled, sepsis is preventable and it can be reversed by the administration of the appropriate antibiotics. Antibiotics are drugs that kill infection. The first thing you have to do is you have to take a sample of the blood to find out what type of infection is involved. Once you know the type of infection, then the doctor can prescribe the appropriate antibiotics to treat that infection. Not all antibiotics are good for all infections. They have to be specialized and particularized to the particular bacteria involved. But if appropriate treatment is done in a timely manner, by recognizing that there are signs and symptoms of sepsis, by taking a blood culture, by giving the appropriate antibiotics, my experience in these cases is that sepsis is preventable, it can be reversed, and your loved one did not have to die.